Dr. Choll came here from sunny San Diego, California. We have an 85-year-old retired nurse from Carmel Mountain, but more importantly, she's Korean and friends with my mom. And look at this horrible back. She's got degenerative scoliosis, but more importantly, an L4-5 spondylolisthesis. And look at this stenosis. It looks like my mom's stenosis right here. 3-4 is the next, no such thing as a normal level in the spine, but look how big the canal is at the level that does not need surgery. And look how bad the stenosis is at the level that she does need surgery. On top of all that, she's scared to death. She's osteoporotic. She's tiny. And did I mention she's friends with my mom? So I have to do a perfect job. We'll utilize all the latest, greatest technology, including the use of fenestrated screws so that we can augment the vertebral bodies with polymethyl methacrylate cement to deal with the osteoporosis. The sexiest cage alive, computer-assisted navigation, neuromonitoring, the Formula One spine team with all black belts, and my delicate Asian fingers because I have to be very, very careful and do a perfect job because that's what I promised her. So wish me luck. You started. Check that out. Look up there. Look down here. Ooh, loo, 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 loo. It's cheating, I know. But like my mama always said, if you don't cheat every once in a while, you ain't trying hard enough. Doing the contralateral facet fusion. Do not try this at home. You need awesome 3D computer navigation. And that's what we have. Thank goodness. Oh, I love navigation. Look at this. Create the perfect screw trajectory right down the pike. Utilizing the San Diego hole widener. We need a better name for it, but until then, that's what it's called. The official name is the Custom Thoracic Lanky Probe, straight Lanky Probe. So you see why we call it San Diego hole widener. That's a lame name for an instrument. Putting in the perfect screw. It's going well. The bones are pretty strong, but still need some augmentation. Alrighty, I've got the screws in. I've cemented them in so that they're rock solid. Now I'm doing the approach to do the inner body fusion and reconstruction. The TLIF part. Surgery's going beautifully. So if you're worried, don't worry, because so far so perfect. I'm in the disc space now, being very gentle so that the bone is not injured, because you're a delicate flower. Here it is, the sexiest cage alive. It's 3D printed surface, etched, bone ingrowth with rounded edges, bulleted tip, and it's going to expand twice as big as what it is, and it's going to be a true 15-degree expansion. I'm going to put two next to each other. That way your osteoporosis is negated by a huge footprint of an inner body spacer. That's my story. I'm sticking to it. Don't tell the hospital because this is going to be very, very expensive. I'm sure somebody's going to call me from finance and go, Dr. Kidd, next time you put in 2 of those really expensive implants, can you let us know ahead of time? And I'm like, why, so you can cancel the case? No speak English. Right there, shot. Oh, yes. Effectively putting a 20-watt cage in there. And loving it. I like it. It's going to be a little posterior, but not too posterior. You see it? I'm going to have to do a decompression. A direct. See it again? Like it? Oh yes, I'm almost there. So a lot of people ask me, how do you get a rod down a little incision? You use things like this. It goes in like that and goes. It's magic. Here you go.
Thank you.
Oh, we're putting the dressing on. You have any idea how small that is? It's that small. Because Kendra's fingers are puny. They're like children's hands, like delicate flowers. The surgery went so beautifully. We don't know what to do with ourselves. But I'm gonna definitely send pictures to my mama because she's expecting me to do a perfect job. And this went perfectly. So, best wishes on a speedy recovery. And make sure that my mom loves me. Good luck.